My name is Guy Neff, and I'm a practicing physician. I'm a hepatologist that takes care of people with liver disease. And my health issue is progressive arthritis. I have my hips, bilateral hips, have bone-on-bone activity, a grade 4 type of arthritis, and my right elbow from overuse as well as aggressive arthritis. The hip pain started about 5 years ago, and it's prevented me from really full activity as far as gym activity, keeping my health and lifestyle. And it's gotten to a point too where I'm able to ambulate, but it's with constant pain. The elbow pain has been more so for the last 5 to 10 years. It had reached a point where my range of motion was greatly affected. It hurt to do daily activities such as brush my teeth, shaving, those types of things. Yes, as an old athlete, lived on Advil or NSAIDs, and actually developed hypertension because of that, the renal-related NSAID type mechanism. So I'm now on 2 blood pressure medicines because of this. Worked with physical therapy to try and improve the range of motion and keep vascularity in place using Nuvi, especially on the left hip and my right elbow. The overall assistance with range of motion, really, there wasn't much help. And with ability to ambulate, sometimes it made it worse, especially in the first 24 to 48 hours after treatment. I am the owner of a very large research company, and we're looking to create a metabolic type of clinic process. With this, we started to hear about PDPA, started to connect through podcasts with Dr. Sewell and listening to his podcasts and some of the great work he's done. So we purchased some product. I tried the IV form of the PDPA and had some great success in terms of pain, especially with my left hip. I was quite amazed, and that's why we came here to better analyze and see how much more effective injecting into the joint would become. My experience was quite remarkable. I was obviously quite nervous about injecting into the hip. The elbow, I presumed it would be a bit easier than the hip being a joint that's a little bit harder to reach, but my experience was fantastic. I actually am able to sit now without hip pain, and that's less than 24 hours out. My elbow feels much better. I have a fine tremor from my COVID experience from a year ago in my hand. That even improved. All in all, it's been just a great experience. It's a newer type of therapy, so anytime you're into that type of setting or atmosphere, you're a bit nervous. And I'll say Dr. Sewell's bedside manner was very comforting. He made sure that not to overuse or be aggressive in the treatment process, but was very confident in his approach and his ability to treat, especially the hip joint. After I was done with it, it was quite relieving to know that there's minimal pain and that it was quite effective. It was just amazing. Very similar. It's a relaxed atmosphere. It's a unique therapy, so getting the message out to people that this is stuff that can save a joint. This is stuff that can decrease pain and improve your quality of life, this is real exciting. Oh, 100%. Anytime you can change someone's quality of life and improve it, that's a must. And I'm not going to be shy about talking to people about my therapy.